Hi, my name is Derek, charge nurse here on the orthopedic floor at Spring Hill Medical Center. Some of the duties for charge nurse is to run the floor, to make the schedule for the oncoming shifts, take care of your patients, help with any patient's problems, help with getting patients ready for any tests or procedures they're going to, and at times go to meetings throughout the day to talk about how the floor is being ran. Like other orthopedic nurses on the floor, charge nurses have their own patients, but in addition to, they'll handle complaints, run the desk, help train new employees, go to any meetings that are necessary if the manager cannot go, and help any nurse that has any problem on the floor, and they'll ask our guidance. My typical work week is 3 12-hour shifts. From 6:30 in the morning to 7 o'clock at night. We get a 30-minute lunch. It's a lot of work, a lot of on your feet. You don't get to sit down very much. We can deal with a lot of stress. We got really sick patients. Sometimes they do pass away and we have to deal with their family members. There's a lot of stress from management, getting patient in, admitted on time, and especially discharged on time. So it's not a laid-back, cushy job as everybody thinks it is. If you're interested in being a charge nurse, first you would have to go to college, either get a 2-year degree or a 4-year degree in nursing, work on the floor, somewhere in the hospital, gain valuable experience, show your leadership qualities, handle adverse situations, and be able to teach on the fly, and then someday you can become a charge nurse. To be a charge nurse, you should probably be the strongest nurse on the floor, with starting IVs, doing dressing changes, and helping out in general, just so you have really good leadership qualities. The best part about being a nurse is when the patient comes into the hospital, they're bedridden, all broke up, can't move, can't take care of themselves, and by the time we get through with them in physical therapy, they're usually able to walk out of the hospital and lead a productive life. One of the best things about being a charge nurse is seeing the new employees who I've taught and trained grow as a person and as a nurse, and go on and have a successful career in nursing. All right, and some of the worst parts of nursing is, you see the blood and guts. You do have a lot of back-breaking work, moving, sliding, picking up, some people 400 pounds, some of them even higher weight. A lot of people can't handle the sights and sounds and smells that we do see here as being a nurse. Related to being a charge nurse, you will deal with all the problems on the floor, including your patients, the other nurses' patients, and like if a patient does pass away, you will be dealing with that and the family members. So sometimes you do have a lot of burden placed on you, and you have to be able to handle it. My advice to any high school student considering a career in nursing would be to take all science classes that are available, especially anatomies and biologies. Take math, including algebra. I know nobody likes algebra, but you need it. Also, if your high school offers any healthcare related programs, join early and stick with it, because it will help you greatly. And consider volunteering. We do have volunteer opportunities at the hospital. One is a candy striper, which they are exposed to a lot of different things here at the hospital and get a good bit of experience. The competition is very stiff to get in nursing schools now, nursing programs. So take your SAT and do your best, and good luck.